Hi, my name is Kay Brown and I'm a UAM nursing student, and today I'm going to be showing you how to do an intradermal injection. So first you'll check the order of the medication that the doctor has sent, and then you'll go into the med room and check the order again. So for today we're using this, and it's the purified protein derivative 0.1 milliliters. And so for this we have a syringe that's a 1.0 milliliter, 27 gauge, and 1/2 inch. So then at this point I'm going to put on gloves, or perform hand hygiene and then put on gloves. Okay, so now I'm gonna use this alcohol pad and wipe the top of the vial. Okay, and discard of that. Then I'm going to get the needle out. And I'm just gonna remove the cap. And I'm gonna pull out 0.1 amount of air. Okay, then I'm going to insert it into the vial, and I'm going to push out that air. Then I'm going to flip it over at eye level, and I'm going to draw out 0.1. Okay. So now I have 0.1 in there. I'm gonna make sure there's no bubbles. I pulled a little bit more than 0.1 so that I can push out any bubbles. Okay, that should be good. Okay, so that's all good. And so now I'm going to cap the needle. Okay, so that can stay there. So now I'm gonna remove these gloves, and I'm going to perform hand hygiene. I would dispose of that in a biohazard bag. Hand hygiene. And now I'm going to put on these gloves. So now I'm just gonna, before I start to inject, I'm gonna go over the 5 rights, just check again with my MAR. So the 5 rights are the right patient, the right drug, the right dose, the right time, and the right route. So once I do that, I'm gonna assess the skin, make sure there's no bruises, there's no swelling, edema, ecchymosis, none of that. So I have my gloves on, so now I'm gonna get this alcohol pad, and I'm gonna wipe the skin, and you're gonna wipe in a circle from the inside to the outside. Okay, and dispose of that. And I'm gonna check the MAR just one more time before we inject. So now I'm gonna take the needle and uncap it. I'm gonna make sure the bevel is up before I inject. I'm gonna hold the skin taut, and you're gonna inject in a 5 to 15 degree angle. Okay. And pull out. Okay, and so now you're gonna cap the needle. And usually you would push this up, but because we are doing videos, just for the sake of videos, I'm not going to. So you would discard that in the sharps container. Okay, so, and you're gonna inspect the skin for anything that looks abnormal. If there's any excessive bleeding, you're just gonna blot the skin. And if it were more than usual, you could put a Band-Aid over it. And then you discarded these gloves in the trash. And that's it.